My name is Jason Schuster. I'm a doctor of physical therapy. Before that, I was a fly fishing guide in Patagonia, Chile for a decade. Now I own a continuing education company teaching other doctors how to do a couple things, including dry needling. This is a part of my online dry needling class, Online Dry Needling 1, Dry Needling in the Autonomic Nervous System. This is about how to specifically target the autonomic nervous system with dry needling. This is a great course, you guys. You can check it out on our website, intricateartseminars.com. Check out the first part of this video series on my YouTube channel. Hope you guys enjoy it. All right, you guys, so dry needling to treat post-shingles neuralgia and fibromyalgia. This is a really, really good topic. Both of these impairments are something that a ton of people have problems with, and both of them are 100% very easily fixable, and they're both considered idiopathic, unfixable diseases per our mainstream medical system because they're two things that make the mainstream medical system a ton of money, and they just simply don't want to fix them. That is the way that our medical system works. So when you have patients that are suffering and have their lives destroyed by things like fibromyalgia, post-shingles neuropathy, and they go to a regular mainstream medical doctor, which is the vast majority of doctors in the United States, they're going to prescribe gabapentin, they're going to prescribe muscle relaxers, they're going to prescribe painkillers, and when none of those things actually fix the problem, because none of those things address the cause of the problem, so they have 0% chance of actually fixing the problem. When those things don't work, they just chalk it up as an idiopathic, unfixable disease that somebody's going to have to deal with for the rest of their life, which just so happens to make the government and the pharmaceutical companies a shit ton of money while it keeps people sick and poor for the rest of their life. So that is our system. If that sounds good to you, just keep using your health insurance for everything. It's really unfortunate, you guys, but using health insurance in the United States for medicine is a recipe to get the worst medical care that you possibly can in our country. And it's horrible because it precludes a huge amount of people from getting good medical care, but that's just the way the system is, you guys. So fibromyalgia is this is a very vague definition. It's stunning that this was ever able to even get into a medical book. But more or less, you guys, if you poke your finger into somebody 18 times and in different parts of their body and 11 of those hurt, they are diagnosed with fibromyalgia. So yeah, you could do that for 100% of 100 of all physical therapy patients, right? All of them you could do that with. So it's estimated that per the literature that 2 to 8% of the world population is affected. So that's an obscenely large number when you're talking about 8 billion people, right? So like 8% would be like 800 million people. It's an insane amount of people. So that are suffering needlessly, you guys. So fibromyalgia is caused by central sensitization of the central and autonomic nervous system, or another way to say that is chronic sympathetic autonomic nervous system hyperactivity. That causes all the dysfunctions in the nervous system like we've talked about so far, including amplification of pain amplifiers, so increased concentration of pain amplifiers, decreased concentration of endogenous painkillers, or like beta endorphin. And then if a rheumatologist makes a diagnosis, again, 11 out of 18 points that they've determined, if you're tender in 11 out of 18 of those points, you have fibromyalgia. So I don't know where they get this low number of 2 to 8% is, but you could literally poke your finger in 11 of those spots in 80% of the population, and they would be sore, because per the United States government, 80% of the population is living with chronic overweight, obesity, or morbidly obese, or they're chronically, 80% of the U.S. population is overweight, obese, or morbidly obese, and 90% of the population is metabolically unhealthy, which is just another way of saying they're living with chronic sympathetic nervous system hyperactivity. So fibromyalgia doesn't involve, it doesn't like have to involve damage to anything. There can be no actual physical visible damage under imaging to the body, and you can easily have fibromyalgia, because fibromyalgia is not like it doesn't happen secondary to like getting hit with a punch or being in a football game or something like that. If you play football a bunch or you play hockey, you don't like automatically have fibromyalgia. Fibromyalgia is a autonomic nervous system dysfunction, and it's the same exact thing as saying chronic sympathetic hyperactivity, you guys. Fibromyalgia Chronic sympathetic hyperactivity, exactly synonymous terms, because fibromyalgia is happening because of chronic sympathetic hyperactivity, just another word. Or you could say, the way that they say it is that chronic nervous system dysregulation causes fibromyalgia. They're more or less the same thing. So just like we talked about the whole rest of the class, you guys, treating the parasympathetic dominant portions of the spinal column or the body, and then targeting as much pathology throughout the body as you can. And that's going to be, you're going to be doing different things with different people, not per the parasympathetic specific treatments, but per the rest of their body. They're going to have problems in different areas. So the most pathologic tissue for one person is going to be different than treating the most pathologic tissue for another person. But this is just a simple math equation to go back to the mitochondria, guys. Another synonym for fibromyalgia could be mitochondrial dysfunction, which is one of the 12 hallmarks of aging. Or it could also be genomic instability, which is another one of the 12 hallmarks of aging. Or it could be telomere shortening, which can cause fibromyalgia, which is another one of the 12 hallmarks of aging. So all of these descriptions for the vast majority of these neurodegenerative, autoimmune, idiopathic diseases, you guys, the cause of all of them is almost exactly the same across humans. The reason that their sympathetic nervous system, again, is hyperactive may be slightly different, but on average, it's a combination of eating processed food, not eating good food, not supplementing with the proper supplements and nutrients and vitamins, not exercising. Those are the primary ways that people get into chronic sympathetic nervous system hyperactivity. And once it's been going on for a certain period of time, you guys, I'm 42 years old. This is the time of people's lives when, if they've been out of shape for their whole life, their body just starts to break down because you're living with chronic energy deficiency. The mitochondria can't produce enough energy because they don't have enough oxygen. They're not producing enough ATPs. And then certain individuals' bodies, secondary to that, are going to present with things like fibromyalgia, or if they get shingles, that's another really severe stimulus to the sympathetic nervous system. It just basically chickenpox re-showing themselves, and that stimulates your nervous system. And if people are already living with the sympathetic nervous system that's stuck way near their threshold, anything that happens to them, including shingles or car accident, breaking your hip, mental stress, whatever, can push the nervous system over the edge where it can't find its way back to homeostasis. And that's when really, really bad systemic stuff starts to happen. So the nice thing about thinking about needling the way that I think about it, you guys, I think, is I never think about treating any condition differently. I'm always thinking about how can I maximally regulate this person's autonomic nervous system. Across the board, a more regulated autonomic nervous system improves all aspects of health. So that is the most fundamental target that we can look at in trying to improve the most variety of health aspects and physical mental health aspects as we can for people. So vagus nerve, cranial suture lines, all the stuff that we talked about already, you guys. And then depending on where they have shingles is going to determine a lot of where I treat. So there's a bunch of good stories. I'll tell you guys a story about shingles in a second, which is very, very similar to fibromyalgia. Again, they're both coming from the same underlying problem area, which is the sympathetic nervous system is too hyperactive, the parasympathetics are depressed, and the nervous system can't self-regulate, it can't communicate with itself. As far as shingles go, you guys, this is one of my best stories from a patient that I've had, and this couple has turned into good friends of mine. So this lady called me about 4 years ago, and she said, "Man, I read one of your articles on post-shingles neuropathy, and my husband and I have been all over the country. We've gotten all the correct stuff done." So I asked them what they had done, where they'd been. They're very wealthy people, you guys. They have a house in Colorado. They've been to the nice Vail Orthopedic Center. They'd had acupuncture done. They'd had massage, gabapentin, MRIs, all sorts of stuff. They did everything that a regular person should do if they don't understand all this other stuff. Those are the logical steps to take. They had zero improvement with any of those treatments, except they said the acupuncture and the massage made a tiny, tiny, very temporary difference, and then the results kind of disappeared. So when I talk to people like this, you guys, they fly out to see me. I don't charge them anything for when they come to see me. So I really want to make sure that they're not going to waste money on a flight or anything like that to come out and see me when I just don't have any shot at fixing them. So it's not very hard for me to figure out. I ask them a handful of questions like, did you anything new in your life happen? Start taking any new medications? Blah, 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 blah. Just basically trying to figure out, is there something that I can't address that is likely causing this person's impairment? And is there somebody else that I need to send them to that may have a better shot at helping them than I do? So if you look at the stats, you guys, the vast majority of the United States population, at least people about my age, have had chickenpox at some point. So most humans have some form of a herpes virus in their body. People always like, it's very kind of funny to me that people make fun of like the sexually transmitted herpes so much, because it's more or less like the same thing as chickenpox or shingles or a bunch of other stuff like that, you guys. So most patients that get shingles are over 50. It's just basically a reactivation of the old chickenpox virus. It looks like you got, like, if it visibly shows, it looks like you get little hives around nerve paths. Shingles lives in the nerves, so it sits in the nerves and then it gets aggravated. This guy got shingles in his butt like 2.5 years before I saw him, and the visible shingles went away, and then he just started to develop horrible neuropathy in his left leg. So he had them in his left butt cheek. Those went away, and then he slowly started to develop neuropathy after that. And he went from very, very healthy older guy to crippled. He was in a wheelchair, couldn't put any weight through his leg whatsoever, through his left leg. And he was going to be like that, you guys, for the rest of his life if he hadn't found somebody that could do something similar to what I do. That is one of the many types of things, especially when you're like 65 or somewhere around there. If your body starts to develop a problem like that, it starts a cascade of further nervous system dysfunction. So unless something is specifically done to get in there and interrupt that nervous system degradation into more sympathetic hyperactivity and more parasympathetic hypoactivity, it's a huge problem. So when I was talking to this guy, I asked them if they were in good shape. Did they eat well? Did they exercise? Yes. They told the truth about all that stuff. They showed up to my place, husband and wife, probably about 65, super, super nice people, extremely good shape. And so in 3 days, you guys, in 3 days of needling him, I needled him twice a day for about an hour to an hour and a half each time. In 3 days of needling, I had him 85% better. They came back out a couple weeks later. I treated him for 2 more days. He was 100% better, 0 symptoms, and that was 5 years ago. I still talk to these guys all the time, you guys. And so why can a stupid little needle with no medicine on it or anything completely fix something that mainstream medicine completely fails at fixing? And this is true across the board for a ton of different stuff, you guys. It's because if you understand why these things happen, which we do understand what's going on with shingles, you guys. It's just that the mainstream medical practice is so screwed up and people have been so brainwashed that unless the thing that they are told to do by the public health agencies, which are criminally, medically negligent, unless the stuff that the public health agencies tell them to do don't work, if they don't work, they just call it idiopathic and they just give up on it. However, they will continue to sell the patient pills for the rest of their life, right? Regardless of whether they help the patient or not. So this is just the way that it goes. If you understand that shingles is a herpes virus that lives in the nerve, if you understand that people over 40, most adults in the United States, especially the older you get, the more chronically hyperactive your sympathetic nervous system is going to be. Anything, whether it's shingles, a bad, issue in your life, problems with your kids, job problems, mental stress, whatever, will push your sympathetic nervous system over its threshold, and then it can't find its way back to homeostasis, and that leads to a fast degradation of all the other organ systems. This is exactly how people that break their hip when they're 65, you guys, how 50% of them are dead within 5 years, according to the research. It's the same exact thing that happens. It's not the shingles that is a huge problem in and of itself, or it's not the breaking of the hip is typically not a huge problem in and of itself, the way most older people break their hip. It's that it's enough of a trauma to send their nervous system from an already pathologic state into a bigger, a more pathologic state. And then everything else starts to dysfunction in the body and everything gets worse. So shingles is one of the easiest, post-shingles neuropathy, you guys, is one of the easiest things to fix with dry needling. Again, I don't treat it any differently than I do any other condition. I think about treating the nerve root, which is in my brain is thinking about treating the multifidus. And then whatever nerve path or nerve paths those shingles are in, always treat at least at the proximal end, the distal end, and as much pathology in between. Use those 7 tricks that we talked about. Treat bilaterally, target the parasympathetics. It's extremely helpful, you guys, and it works. It works almost every single time if you do this properly for post-shingles neuropathy and fibromyalgia. So one of the things that I think about, you guys, and I'm sure this is true, is just looking at human evolution and the history of human beings. Whatever you think about like evolution, or if you believe in evolution or whatever, that doesn't really matter. The bottom line is that up until about in 1900, you guys, the average lifespan was somewhere around 50 years old. And now the lifespan has only increased by about 25 years over the last 100 years. So lots of people think that like, oh, our medical system is so great. Look at all the advancements that we've made. I'm not exactly sure what data people are looking at when they say that, but 100% of objective data, you guys, for the last 50 years has shown that every single aspect of human health has gotten exponentially worse as our medical technology has gotten better. And nothing that we have done in medicine, aside from maybe 2 things, has increased lifespan. You ready for these, you guys? Well, lots of people would think like, oh, all these like fancy technologies and stuff. No. Number one is the realization that germs made people sick and that germs existed, and that like things like washing your hands and not throwing literal shit in the streets and cities when you're living in there. When they figured out that that was not healthy for people, tons and tons of diseases went away. People started living longer. One of the other major ones, and this is a more technological thing, but not super technologically advanced, is childbirth, you guys. So lots of people died in childbirth back then. That rate has plummeted. So the 2 biggest things that have increased that 25-year life expectancy since 1900, you guys, the 2 primary things that have led to the vast majority of that increase are just the awareness that germs exist, it's good to be clean, and slight improvements with our ability to deliver children when they're being born without both either the mom or the baby dying, right? So that is one of the reasons that I think that our nervous systems and people start to develop so many chronic impairments somewhere around the age of 40 or 50 is because for hundreds of thousands of years, humans have been living only up to somewhere around 50 or less, you guys. And then we figured out a couple of simple things that increased our lifespan by 50% more or less. So you go from 50 to 75, which I think 76 right now is the average life expectancy in the US. It should be over 100 without any advancements, without any other added things that we know about. We could make the lifespan on average 100 right now, you guys. And one of the easiest ways to do that, and like, I'm not saying this should happen because I think people should be able to do whatever the fuck they want. But if you just completely ban processed food from the United States and you did not ever import any processed food ever again, the lifespan would increase another 20 years, you guys, in the United States. And the health would improve a stunning amount. But that would also lead to nobody needing really healthcare, which would not make all these criminal people billions and billions of dollars off of making the whole population sick. So that is my general thought about like why people in general get so many problems around midlife. You guys, a lot of it has to do with evolution and the fact that if your body is not, if human beings aren't really accustomed yet to living to where we're living now, and you're starting with horrible health, all sorts of bad things are going to happen. So lots of this stuff is very, very treatable. It's just not attempted to be treated. So shingles, just like with everything else, you guys, cause massive amounts of chronic body-wide inflammation. So just like with fibromyalgia, just like with arthritis, just like with chronic pain. The vast majority of people in the United States are living with chronically elevated levels of pro-inflammatory markers like interleukin-1, interleukin-6, tumor necrosis factor alpha, C-reactive protein. There's other ones. We get a turning down or a turning off of anti-inflammatory pathways like the NRF2 pathway, which is a mitochondrial anti-inflammatory pathway. Dry needling has been shown to significantly reduce all of these markers, these pro-inflammatory markers, across diseases or across impairments, because needling is working on one of the most fundamental levels of our neurophysiology that we understand how to target is mitochondrial health and autonomic nervous system homeostasis. It's really, really cool stuff, you guys. Thanks for watching, you guys. To continue this video, make sure to keep an eye on my channel. There'll be many parts to this series. This is part of our online dry needling 1 course. We have 2 online dry needling courses. We have a live online dry needling course, and we have a bunch of in-person dry needling courses, all board certified and accredited. If you want a discount on our online dry needling courses, check out our school community. It's school.com/CEU, SKOOL.com/CEU. You can get a discount there on our online dry needling courses, on our online nutrition courses, and a whole bunch of other good stuff. I have weekly Zoom meetings there. We have a private community chat room. It's a really awesome community. Check it out. Thanks for watching, you guys. See you next week.